welcome back to TCM Study Corner. Today we are going to talk a very interesting topic, the urgent care and emergency procedure about acupuncture, qigong, and dietary support. So before that, let's declare of ourselves. If you have any emergency, please call your local emergency contact. Please dial your number. The only reason we mentioned there's another option for you is when you want to have another more options. You can help yourself or help someone nearby you. So if you have any emergency, remember to dial your local emergency number. And let's move on to our topic. So if I have someone fainted, what would you do? You dial number and then you have CPR procedure, and then you will never connect alternative care or traditional Chinese medicine to emergency. However, it's actually have a lot of points that can help you. For example, the first point of long channel, long one, you raise up your armpit and then you put your hands on your armpit, the pec major right here, our pec major muscles on your chest, and then you just use your thumb to press right on it. It can help to wake people up. And also it's actually emergency points that you can use if you see someone fainted. This kind of situation is when you really want to have extra knowledge to help others, and you wish you can know more when you see a kid fall down and then they're crying or they're actually hurting. Before you ask someone help as a parent, you can use your hands. This is one way of you will use qigong, the breathing technique. You warm up, rub your hands, and it's warmer than our regular skin temperature. You can put your hands nearby or close up to where the kid hurts. That helps too. And speak of, we say the emergency food. We have it too. It's called mixed congee. And one kind of congee that I use a lot when I'm, for example, delivery baby. I carry it with me. It's room temperature, and as can food, you can just open it. And then there's, you just pull, and then you open. See? And they have spoon on the cap right here, and you can just pop open one, and then two. See, it's a spoon, and we can just directly dig in and eat. Yummy. My favorite emergency food. They have a lot of grain inside, like rice and oatmeal inside. So this kind of emergency food is, we say, nourish your spleen and stomach and very fast to fulfill your, give you a fulfilled feeling. And especially for postpartum, like the breastfeeding mom, it's really helps you fast bump up your breast milk. So that's all kind of urgent emergency situation we're trying to offer if you see your family or friends suffering something that you wish you can help. You can take this video as a reference. So if you come to see a practitioner, what kind of emergency procedure we will apply to you? We use 4 diagnosis skills to give you emergency procedure. First one is 1, which we use when you walk into the office. We already start inspecting you. 1, which is your smell and hearing. And then after we sense if you have special odor, or you have special, when you talk to us, when you're greeting, you already start have lower voice, then we can all, based on this hearing and sense, smelling, then we will ask you. Asking is in the 3rd steps. So then you will talk if we ask you more. Then we 问切 is the pose, count and pose to confirm what you actually have. So after we have those 4 procedures, we might give you some special points. For example, people come in have itchy throat and they can't stop coughing, especially in public. It's kind of urgent too. If you can't stop coughing in the public, it's kind of sensitive situation. So what would you do? You might receive a point, you clean up, and then single package. Sometimes we use the 32 gauge and 1-inch needles. And then we apply the needle, and usually we will leave it for retaining time for 20 minutes. So I'm going to just use these points right here. And then for 20 minutes, we will, right here. So for 20 minutes, this is for your itchy throat. For 20 minutes, after we finish our talking, we take out the needles. But if you are in the treatment room, usually we will be quiet and you will hear some music and enjoy the calmness. So I'm just demonstrating how you feel with the needle retention, and we can talk more calmer and slower, like that. So remember, your long one, you can use it if you are helping yourself. You can use your middle finger, just press on your long one. If you feel like you are dizzy or about to faint, if you are helping others, you can use your thumb to go over your armpit and then press on it. And then right now, if you can see, it feels very, very itchy. The feeling is like we call needle sensation. It's like a lot of ant crawling along this my thumb area, radial side, and then along to the tip of my fingers. That's the feeling when you receive needles and when you ask someone's like doctors, practitioners coming to help you. So for acupuncture part, that's how you do. And after we calm down, let's talk the last one, Qigong methods. So we already mentioned we are going to use these 4 steps to give you diagnosis, and then in the very last treatment, you know we have 5 senses, right? We can see you, the eye, sight, and then the nose, smelling, and the ear you can hearing, and then our mouth, the tongue, you can taste it, and the hands, you can touch it. These are all able to treat you. So for example, let's drink some porridge. Actually, let's get some coffee. Okay. And then we can eat some porridge. Mmm. 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 These are all can calm you down. The last one is hearing. When someone is in the last minutes, they still able to hear you. For example, when we have a newborn in your embryo, the first thing is they can hear you. So when we use Qigong methods to treat emergency, you watch back to the brain, and then you swallow down your saliva, and then you breathe in all the way down to the lung and to below your belly button, and then you listen inside of yourself. Focus on your heartbeat, your breathing rhythm, and then that's the time, the moment you can save yourself. I give you an example. When you unlikely in an accident, this way to coming, watch back, listen to yourself, and then swallow the saliva that can nourish your body to save seconds until other people come to save you. That's the emergency we are facing, or potentially we are seeing from others. I hope this kind of information not only you know it, but also spread out to help others, because emergency you never know, but it's always good to know more, right? I'll see you next time. Before we say bye-bye, let's take out the needles. And then I'll see you next time. Bye